When you think of allergies, a lot of the time you're thinking about the spring season, but some people experience even harsher allergies now during the fall. I'm joined again with Dr. Wells from Columbia Breathe Free to talk about fall allergies. Thanks for joining me again.
Hey, thank you for having me. Very excited to be here. This is a huge problem just for so many people.
Yeah, it really is. So, like I mentioned, spring is really the time that people are saying is allergy season with all of the pollen that's coming. But what makes people so miserable during the fall season with allergy symptoms?
Oh my, and we just talk to folks day in and day out, and fall allergies can be just very difficult for a large group of people. We understand when people are calling and saying, my allergy is just way worse now during the fall months. Up to 25 million people in the U.S. suffer from fall allergies.
Wow.
And they can be worse than in the spring. And so the main culprit is ragweed. It peaks in August and lasts until December, really until we have a frost overnight.
Okay.
It's very prominent here in the Southeast. Ragweed is what we call ubiquitous. It's everywhere.
Okay.
So it's along all the roads, it's in yards, it's in fields, vacant lots, really anywhere where weeds are allowed to grow, you're gonna probably have ragweed.
Oh my gosh, that's really interesting. Something else I was thinking about, allergy season, fall, spring, cold season. Viruses, sinus infections. I feel like fall is really the hot spot for sick season. How do you know if you're experiencing something like a virus or a sinus infection as opposed to fall allergies?
That's a very good question. A lot of people are like, what am I dealing with here?
Right.
And they can overlap a lot. So the best way we describe it is with allergies, especially fall allergies, you have a lot of eye irritation, itchiness, watery eyes. You certainly have a lot of sneezing. You can get nasal congestion and that runny nose, that clear drainage. Certainly you can get a cough.
Yep.
Usually there's not a fever. Certainly your symptoms are worse when you're outdoors.
Got it, okay.
When you're thinking more about like a viral or head cold or something, those symptoms, they typically progress and then they kind of resolve after maybe 7 to 10 days. The symptoms can be very similar. So you can have that congestion and that drainage. The drainage is often more thick with a cold.
Yes.
The cough is often worse. You can get a low-grade fever, body aches, don't feel well. But those typically clear up within a week or 10 days.
Yeah. And speaking of people looking for help, when is it time to go and see someone? And also kind of follow up to that, what can people do for relief now?
Right. So some simple things that folks can do right up front is, start looking at the pollen counts.
Okay.
And on really high pollen count days, then, maybe limit your exposure outside, especially in the morning when that ragweed is really going crazy. If you do go outside, wear a mask. That can be helpful. And when you come back in, change clothes. And if you have time, you can even shower off. Just get off those allergens. And then you can start to use some over-the-counter medicine. Some antihistamines like Claritin or Zyrtec. There are nasal sprays like Flonase or Nasonex for congestion. If the medications just aren't working well, or they've just stopped working, or you've been using them and their symptoms are just on and on for several weeks, it's probably time to reach out and take that next step. If you're starting to get more than just a sinus infection or two a year, or those infections are lasting longer and longer, then you probably want to reach out and talk to a specialist like Columbia Breathe Free to help sort things out, and look at some more maybe longer term solutions.
Right. Speaking of longer term solutions, treatments beyond medication. We've talked about this in depth in some other segments, but can you just kind of quickly go over what sort of treatment options are available that are not just medication?
That's right. So, medicines are always a first go-to thing, but they're really just Band-Aids. Right. They just kind of dampen the symptoms. They're not really treating the root cause of the problem. And so some of those treatment techniques we talked about at first can help with sinus type things and really clear those things up for good. For allergies, what we do if you come in and see us is we'll want to do a simple allergy test and find out what are the things that are triggering you as a patient. What's your pattern? What are really responsible for this? And then we can put together a personalized treatment plan. And if you have a lot of triggers, a lot of sensitivities, then that might be an allergy treatment. We call it immunotherapy. And basically that's just a little allergy shot or allergy drops under the tongue. And what those are doing are they just gradually train the immune system to stop reacting to all these things that are a normal part of the environment. And it's very, very effective. Almost 90% of our patients see significant improvement in their symptoms. What's great is during the treatment process, you have much better control of your symptoms than if you're just using pills and sprays.
Wow, that is incredible. You're making lives better every single day.
It's a fun thing to do. It's very rewarding. We love it.
That's awesome. And one more time, can you
Yes.
tell everybody if they're interested in booking maybe a consultation with you guys, getting on a treatment plan themselves, what's the best way for them to do that?
Great, just reach out. You can look us up online at ColumbiaBreatheFree.com, or you can call our main number at 803-233-7763.